We'll see how much, what all we have been successful. Okay, now look down. Can we have a pre-op? Pre-op photo carded up. Cut him.
It looks better.
Yeah, there is improvement, and wherever you wanted the improvement, doctor, I've tried to do maximum possible.
Do you think that the resorption will not be there?
No, it should not be there, because I have used cartilage. They have used bone. Bone resorbs. Cartilage doesn't resorb.
I studied that the resorption of cartilage is 30%, 20 to 30%.
No, show me.
I just yesterday
No,
was in.
the cartilage doesn't resorb. You can check any literature. I'm doing it for 20 years. You can check everywhere. All the rhinoplasty surgeons, the worldwide, the good ones use the cartilage.
Tip couldn't be, na? Then.
Better, but it's better than before, right? I told you I may not be able to do too much. I could improve it quite a lot. And you see the side, this groove, how much improvement. This face, this eyes. Your face looks younger, doctor, now. I told you that will happen. Eyes you see. This eye you see. Remember you told me that medial canthus.
But I think left side node looks maybe blocked.
That will become alright because the sutures inside, everything. We'll clean up all of that. That will be fine. I use lot of stitches inside, and some of them are quite thick vicryl. It takes 3 weeks to go.
Okay.
So you can apply some ipurosin ointment with a earbud.
Yeah. And there is swelling this time.
For you, somehow swelling is less. It's less. It's not too much. It's there, but less than I expected. Because see, I've done bone grafting. Cartilage grafting everywhere. It's not showing so much of swelling.
I hope that it will not go deep.
It will not. Well, 10% swelling, if it's there, it'll come down, but it's not going to be like totally off. You can see the side view also. You can look this side, doctor.
This is the right side.
Yeah, that's the right side. Rendu da irukka? See, even up the tip is improved.
Yeah.
Not a lot, but there is some improvement. In this side, you can see the huge improvement. See, also, if you look at the nose, it's become much more manly now. It starts from there, it's quite broad, it's uniform, it's thicker. All these factors make a nose proportional. You have a large face, and 1/3 of that should be the nose.
Yeah.
Now it is. Earlier it was smaller than the 1/3. So that is another point. So this gentleman, he's a doctor. He's an internal medicine specialist. He lives in the capital of India. He had 2 rhinoplasties done before. I don't want to mention any names here, but he had some concerns. He was very precise what he wanted. Like I said, he's already a specialist medical guy, and also he knows what he wants. I did tell him that I would probably be able to achieve a few of his concerns and maybe not able to achieve one of his concern. So the tip was something that he wanted me to make it pointy along with the other things. So that I've not been able to do so because it was a third rhinoplasty and he has very thick skin. And that was one of the things. But we worked a lot on the radix, and you can see we've augmented that. We've given him a nice long nose. I've worked on the osteotomy. You can see that. And you can see this grooving that's already gone. It's much lesser. You can see the place around the eyes, this fullness. It's stretched, stretched, stretched. So I think out of the 4 or 5 major concerns he had, I've addressed 4 of them entirely or totally and 1 partially. Am I right?
Yes.
Which means you're 90% satisfied.
Yeah.
That's good to hear, doctor. And you're traveling tomorrow?
You're traveling today.
Traveling today. Okay. So have safe journey. And you know how to take care of yourself.
Yeah.
And let us know how you feel in the next.
Yeah, I will give feedbacks.
Yes. Did you expect something better when we or did you, or were you like, okay, this is happy overall?
Overall, I'm happy.
You're happy?
Yeah.
I'm glad. It was a very challenging case for me, because especially when I'm dealing with physicians and doctors and people who've had a surgery before, and we have limitations. Sometimes we are not able to.
100%.
Yes,
Yeah.
unfortunately, that's life. But I think it's nice. I'm personally happy that I could give this much for you, and I'm also more happy that you're happy with it.
Yeah. So, thank you.
Okay? Take care, doctor. Thank you.
Thank you.
But we could have just